Hello, everyone, and welcome to our question lab this evening. We're happy to have you here, and we're glad you're able to join us. Today, we will be covering microbiology pharmacology. My name is Sean. I've been with RX Coach for a little over a year and a half, and we'll talk more about RX Coach a little bit later in our lab here this evening. Leading today's discussion is Ari Stone. I'll let Ari introduce himself.
Great, thanks, Sean. So hey everyone, like Sean said, my name is Ari Stone. I'm a M4 at the University of Wisconsin, going into otolaryngology, head and neck surgery, hopefully. And I'm a non-traditional student. I originally got my degree in English from Loyola and then found my path into medicine. So a couple years in the technical writing world, I went back to school, and the rest is kind of history. I've been with RX Coach now for about 3 months, working with students mostly one-on-one to help them prepare for Step 1 or COMLEX Level 1 in a way that matches students' individual learning styles. So if you regularly come to our question labs, the last couple weeks I've been on helping respond to your questions, but tonight I'm going to be helping you all walk through these clinical vignettes and hopefully learn a little bit of high-yield micropharm. So excited to get started.
Excellent. Thank you, Ari, and thanks for being here. We look forward to the discussion. We also have some wonderful panelists joining us today. If you look at your GoToWebinar control panel, you will see a question box. You can enter questions for our panelists in that question box, and they will do their best to answer your questions. Our first panelist today is another one of our RX coaches. She is new to Question Lab. This is her first one, and we're happy to have her. Her name is Lisa Velez. And Lisa, I'll let you introduce yourself.
Thank you, Sean. So as he said, my name is Lisa. I'm a fourth-year medical student at the University of Puerto Rico. I've been working with USMLE-Rx for 4 months now, primarily working one-on-one with students preparing for the USMLE Step 1. I'm very excited to be here.
Excellent. We're glad to have you. We also have Jeff and Kate joining us, and you'll hear from Jeff a little bit later. We're happy to have them here to answer your questions. Now that you've had a chance to meet and get to know some of us, we'd like to get to know you. So I'm going to ask you guys a question, and we'll give you guys a couple of seconds to respond to the question, which exam are you currently preparing for? This is the same exact box that will show up throughout the evening as we do 4 questions on microbiology pharmacology, and we'll have you submit your answers in the same box for those questions. So we'll give you a couple more seconds to respond, and then we will go over your responses and move on. We're happy to have you here. Make sure you guys stick around until the very end because there are less of you here this evening, which means your chances of winning the raffle has gone up drastically. So make sure you stick around until the very end, and maybe you will be one of the lucky winners tonight. And once again, it looks like a majority of the people here, 97% of you, are studying for the USMLE. Keep in mind that RX Coach, we do tutor for Step 1, COMLEX, the CBSA exam, Step 2, as well as in-school exams. So keep that in mind if you want to work with one of our wonderful coaches like Ari or Lisa, and we'll talk more about that program a little bit later on. Now that we know what you're studying for, let's figure out when you're planning on taking the exam. So I'll give you guys a couple more seconds to respond here to when are you planning to take Step 1? We'll give you guys a couple of seconds to respond, and then we will get into our first question of the evening. Just a reminder, next week we will be covering renal physiology. Renal physiology next week, Tuesday, 6 p.m. Eastern time. All right. It looks like a lot of you here today are taking your exam before the end of the year. A lot of you guys are taking it here between July and September, and many of you are taking it next year. And I'm confident that this webinar will be of benefit to all of you here in attendance today, and we're happy to have you. With that being said, and without much further ado, let's get into our first question of the evening. Before we do that, I do want to mention that the methodology we're using today, the same methodology that we use in RX Coach, which is our new one-on-one tutoring program, and we will talk more about that later in the evening. Our first question of the evening, as you guys can see, I have went ahead and covered up the answer choices for you. That is something we always do at RX Coach. It is our first step, and the reason we do that is because we don't want the answer choices to guide your thought process or to dictate your thinking, okay? We also don't want you to see an answer choice that you're unfamiliar with, and that may cause you to panic as you're trying to read the vignette on test day. So I've gone ahead and covered up those answer choices for you, and we'll reveal those a little bit later. After we do that, the second step is to read the lead-in, which is the last sentence or the question itself. And so we will read that here now, and we'll read it together. What is the mechanism of action of the new medication that the patient is administered? What is the mechanism of action of the new medication that the patient is administered? Now, we'd like to ask our students in our coaching sessions, is this a one-step question, a two-step question, or a three-step question? And that's very important to make sure that you know that, because that will allow you to make sure you keep your thought process organized and ensure that you are answering the right question and not forgetting any steps. So an example of a one-step question would be, what is the diagnosis? An example of a two-step question is when they ask you, what is the treatment for a diagnosis? And an example of a three-step question is when they ask you, what is the mechanism of action for a treatment for a diagnosis? With those examples in mind, I'm going to give you guys a couple of seconds to type in the chat box, or sorry, the question box, and let us know how many steps you think this question will require us. We'll give you guys a couple of seconds to let us know. And we see some responses coming in. We have students saying that this is a three-step question, a two-step question. Some people even saying it's a one-step question. All right. Well, Mr. Ari Stone will go over that with you guys here in a moment. So after we read the lead-in and know how many steps it's going to take us to answer this question, we will begin to read the vignette or the stem itself. Now, in our coaching sessions, we will stop you after every sentence and ask you, what's important? What do you want to highlight? Which clues are important? Which ones are not so important? What are you thinking? What's on your list of differentials? We can't do that with all of you individually today because there's so many of you here. So I will pause briefly after each sentence to give you guys a moment to gather your thoughts. So here we go. A 22-year-old woman who is a medical student comes to the office for a follow-up evaluation of tuberculosis. She no longer has a cough, shortness of breath, fever, or night sweats. 48 hours after receiving an intradermal injection for TB screening, the site of her purified protein derivative, or PPD test, shows a region of induration measuring 12 millimeters in diameter. A chest X-ray is obtained and shows no abnormalities. Treatment with isoniazid is initiated. 2 months into treatment, she experiences a sudden onset of fever, rash, and joint swelling. Treatment with isoniazid is stopped, and a new medication is administered. What is the mechanism of action of the new medication that the patient is administered? And with that, I will hand it off to Ari Stone.
All right, thanks, Sean. So first step, as Sean just mentioned, is figuring out if this is a one-step, a two-step, or a three-step question. And in this case, I think it's probably a three-step question. It might be two, and so it sort of depends on whether we're given the diagnosis or not. So for me, I'm thinking first, number one, we need to figure out the specific diagnosis, and then we need to figure out what medication was actually prescribed for that. And then thirdly, we need to recall what the medication's mechanism of action is. So we're going to now go ahead and read the answer choices aloud. And we recommend starting with the answer choices, starting actually at the bottom and kind of working your way up. So in this case, starting with E and working your way up to A. And the reason we do this at RX Coach is because we don't want you to get distracted or have kind of knee-jerk reaction to an answer choice that you come across early on, and then just select that without kind of going through all of them and giving each one of them their due diligence. So we'll go ahead and do that here, starting with answer choice E. So E increases synthesis of cGMP or cyclic GMP. D decreases synthesis of peptidoglycan. C decreases synthesis of folate. B decreased synthesis of mycolic acids. and A, decreased synthesis of messenger RNA. So you might see Sean is going to go ahead and pull up a poll here, and you might see that come up here, and we'll just give you guys a second to kind of gather your thoughts, and when you think you've got the right answer, if you want to guess, go ahead and answer in the poll on your screen. We'll chat about this in a second.
Excellent. So we'll give you guys a couple of seconds to respond. Remember that on test day, there is no penalty for guessing. So do not ever leave a question blank on test day. So today, if you don't know what the answer is, do me a favor and take your best shot, take your best guess, and we will go over the incorrect and correct answers at the end. Remember, when you're doing questions, it's important to make sure that you've got to the right answer for the right reason. And you also understand why the correct answer is correct and the incorrect answers are incorrect. And so we're going to teach you how to do that here in a little bit. And it looks like a lot of you guys have voted. We'll give you guys a couple more seconds to respond. Excellent. Let's see how you guys did. Looks like 54% of you guys picked answer choice A, which is decreased synthesis of messenger RNA. And in second place was B, decreased synthesis of mycolic acids. Let's see what the correct answer is. And the correct answer is A, decreased synthesis of messenger RNA. So great job. 54% of you guys got that right. For those of you who didn't get it right, don't worry. Future Dr. Stone is going to give us that explanation now. Dr. Stone.
Okay, excellent. So here we have a patient presenting, and we're given actually that she's presenting with a follow-up for TB. Now, she definitely had an active TB infection at some point, because we see these symptoms detailed here: cough, shortness of breath, fever, night sweats. However, it's noted in the question stem that she no longer has those symptoms. She's got a positive PPD test, as we'd expect, but she's got no abnormalities on chest x-ray. And so all of this, guys, points to the fact that she has a latent TB infection. So we need to figure that out first. And then our other clue that it's latent is this: the question stem tells us she started on isoniazid. And if you recall, isoniazid is kind of our first line monotherapy to treat latent TB. Okay, great. So what's going on with the second paragraph? Well, we find out that 2 months into treatment, the patient gets a sudden onset of fever, rash, and joint pain. And obviously this is hinting at some kind of adverse reaction, some kind of side effect from the medication. Do you guys know what's the specific side effect that this might be referencing that isoniazid can cause? And so if you want, you can go ahead and type your answer, your guess, in the question box.
We have a couple responses so far. One of them is drug-induced lupus.
Excellent, exactly.
Another taker for drug-induced lupus. Some people saying peripheral neuropathy, and some saying B6 deficiency. So
absolutely. So absolutely, isoniazid can cause a whole host of problems for sure, a whole host of side effects rather. But one of the kind of classic boards ones is drug-induced lupus for sure. That's not unique to isoniazid, but it's definitely a classic cause on the boards. So if someone has that kind of extreme reaction, we need to put them on another anti-tuberculosis drug instead. And the alternative that we can use here for latent TB is a 4-month course of rifampin. And if you guys remember, rifampin's specific mechanism of action is that it inhibits bacterial DNA-dependent RNA polymerase. And so ultimately what that does is decrease transcription, right, or the production of messenger RNA. So now let's go over the other answer choices, and we'll kind of go over why they're incorrect, starting with answer choice E. So answer choice E increases synthesis of cGMP. Now this is actually a distractor that doesn't even relate to another antimicrobial. There's probably a few vasodilators that work by this mechanism. So something like directly like hydralazine, or maybe indirectly like our PDE5 inhibitors like tadalafil, sildenafil, but this one can't be it because this is not a mechanism of action for an antimicrobial here. We get to answer choice D, decreases synthesis of peptidoglycan. That might describe any number of drugs within the penicillin class, right? Or maybe vancomycin, but none of those would effectively treat TB. So it's important for you guys to remember TB is a little bit special mycobacterium because it doesn't have a peptidoglycan cell wall. So a lot of the typical antibiotics that we use to treat other bugs are not going to work with tuberculosis. C, decreases synthesis of folate. That might be describing either dapsone or any antibiotics in the sulfonamide class. So dapsone can be used in the treatment of another mycobacterium, and that's Mycobacterium leprae, and that causes the disease leprosy. But it's actually not one of the anti-tuberculosis drugs that we typically think of. And so finally we come to B, decreased synthesis of mycolic acids. And this one it's quite a good distractor because it actually refers to the original drug that this patient was put on, isoniazid. And so, well, it doesn't matter for this particular question. Remember that there's something special about isoniazid's mechanism of action. So before it can actually get to this point where it inhibits mycolic acid synthesis, it needs to be turned into an active metabolite form. We can see that on the page for isoniazid, and that's actually done by bacterial catalase peroxidase. So when we think about resistance to this drug, that's another common question. They'll ask about resistance based on mutations in this gene encoding for that enzyme, CATG. All right.
Excellent. Thank you, Ari. So good job to everybody who got it right. If you didn't get it right, hopefully you learned, and we'll get it right on test day. And with that, let's go ahead and move on to our second question of the evening. I noticed that some of you guys just joined us, so I want to let you guys know that I have gone ahead and covered up the answer choices, and we do that as part of RX Coach. That's our first step with all of our students, and we do that to make sure that the answer choices don't distract you or guide your thinking. And we also want to do it to make sure that you guys don't see an answer choice that you're unfamiliar with and then end up panicking as you're trying to read that question. So once that's covered up, we will read the lead-in together. Which of the following is the mechanism of action of the agent most likely administered with imipenem to boost its efficacy? Now that we've read it, I want to give you guys a second to respond in the question box and let us know how many steps you think this question will require. So let us know in the question box if you think this is a one-step question, a two-step question, or a three-step question. Excellent. Looks like we're getting some responses, and Ari will go over the amount of steps with you here in a moment. After we do that, we want to read that question stem together. Now, in our coaching sessions, we will ask you what you want to highlight, what the important clues are, what you're thinking, and why you didn't highlight what you didn't highlight. We don't have time to do that with all of you here today, so I will pause briefly after every sentence to give you guys a moment to gather your thoughts. A 14-year-old girl with cystic fibrosis who has been hospitalized multiple times in the past for pneumonia is brought to the emergency department because she has a productive cough, fever, and shortness of breath. Physical examination is remarkable for decreased breath sounds and dullness to percussion in the right lower lobe. The patient is hospitalized. A complete blood count shows a white blood cell count of 17,000. Bronchoalveolar lavage reveals Pseudomonas along with several other organisms. When no clinical improvement is observed after administration of several antibiotics, imipenem, a broad-spectrum antibiotic from the carbapenem class, is administered. Which of the following is the mechanism of action of the agent most likely administered with imipenem to boost its efficacy? And with that, I will hand it off to Ari Stone.
All right, thanks, Sean. So of course, our first step here, guys, is going to be figuring out, is this a one-step, a two-step, or a three-step reaction or question? And in this case, I think it's probably got two steps that we need to find. So first, we actually need to know what is administered with this drug. We're given that we give imipenem, but what is administered alongside it? And then we need to know what its mechanism of action is. So it's a fairly discrete question. So again, just like last time, we're going to go ahead and we'll start at the bottom and we'll read each of these answer choices aloud. And once we're done with that, Sean will put up a poll and you guys can kind of respond with your best guess to what this mechanism might be. So E inhibition of dehydropeptidase 1 at the proximal tubule of the kidneys. D, inhibition of bacterial folic acid synthesis. C, inhibition of bacterial beta-lactamase. B, inhibition of DNA gyrase. Or A, disruption of the bacterial cell wall to allow entry of imipenem. So go ahead and put your answer up in the poll, and that shows up on the screen now.
Excellent. We'll give you guys a couple of seconds to respond, and then we will go over the correct and incorrect answer choices. Looks like a lot of you guys are starting to respond. We'll give you guys a few more seconds. Make sure you take your best guess if you're unsure what the answer is, and we will review all of these answer choices here together. I know micropharm is one of those areas that gives students a little bit of trouble because there's so many drugs and some of them sound similar to other drugs, and there's lots of bugs that sound similar to other bugs, but it's important to know, and it certainly is all high yield for your exam. So hopefully today will be helpful, and it will help you keep some of those bugs and drugs straight. All right, let's see what you guys selected. Looks like in first place was E, inhibition of dihydropeptidase 1 at the proximal tubule, with 45% of you picking answer choice E. In second place was answer choice C, with 28% of you guys picking inhibition of bacterial beta-lactamase. So let's see what the correct answer is. And the correct answer is E, inhibition of dihydropeptidase 1 at the proximal tubule of the kidney. So well done, everybody. And let's hand it back off to Ari.
All right, thanks, Sean. So this is definitely a tough question and something, a bit of information that you just kind of have to know. So in this question, we know we have a pediatric patient who's got cystic fibrosis and a history of recurrent pneumonia. And we're actually given a lot of information about already what's going on with her. So she's got some classic signs and symptoms of pneumonia: fever, cough, shortness of breath, leukocytosis, or that increased white blood cell count. And then we actually know that we find other organisms, but we find Pseudomonas when we do a bronchoalveolar lavage. Since she doesn't improve from the initial antibiotics that we give her, we amp it up to one of the big guns, imipenem. So this is a very broad spectrum, powerful antibiotic that we use to treat life-threatening infections. That's kind of the thing to think about with the carbapenem class. They're those what are called the DIME antibiotics, right? They treat 10 out of 10 life-threatening infections. That's your first aid mnemonic. And so there's a little, I guess, slant rhyme that kind of goes along with imipenem specifically and what you need to co-administer that with. So I don't know, Sean, if we have the page with imipenem and the carbapenem antibiotics on it, but you can see here that, again, we talked about the DIME antibiotics. That's the first letter of each one of them in this carbapenem, very hardcore broad spectrum class. And then the slant rhyme here is, with imipenem, we're always going to administer it with cilastatin. So we think the kill is elastin with cilastatin. It's a little bit of a stretch, but basically we know that imipenem gets inactivated in the proximal convoluted tubule of the kidneys, and so cilastatin is going to help kind of keep those levels higher and longer lasting. So this is, again, just something where you need to kind of know this discreetly. Imipenem always goes along with cilastatin. So we'll go back to this and we can go through the distractors together. And again, a lot of these mechanism of action questions, they're just going to, as you see them over and over again, we'll kind of pick up on more and more what drug classes we're describing. So D, inhibition of bacterial folic acid synthesis. That's talking again about drugs like either dapsone or more likely we get tested on sulfonamides. And so neither one of those actually are going to be active against Pseudomonas. That's number one, and definitely neither help boost the efficacy of imipenem. And that's really what we're looking for given the question stem, the lead-in, right, which was most likely administered to boost its efficacy. So C, inhibition of bacterial beta-lactamase. That's referring to our special kind of group of helper molecules called beta-lactamase inhibitors that we do often co-administer along antibiotics, but those would be penicillin antibiotics. So there's also a mnemonic for this that's called CAST, and that's clavulanate, avibactam, sulbactam, and tazobactam. You can find that in first aid. And so while they're helpful, these beta-lactamase inhibitors, while they're helpful at protecting certain drugs against destruction by bacterial beta-lactamase, they're not going to do anything to boost the efficacy specifically of imipenem. All right, answer choice B, inhibition of DNA gyrase. So that's referring to the mechanism of action of the fluoroquinolone class of antibiotics. So I think things like ciprofloxacin, moxifloxacin, levofloxacin, and actually some of them, so levofloxacin, for example, that can work against Pseudomonas. In fact, it'd be maybe even one of our first line picks. But in this example, remember that the patient was actually unresponsive, right? And, treatment was not working with those first-line antibiotics. And so that's why we actually bumped it up to this carbapenem class in the first place. So it's not going to be a fluoroquinolone. That's why answer choice B is incorrect. Then finally, we come to our answer choice A, which is disruption of the bacterial cell wall to allow entry of imipenem. And now actually, this is a tricky one because destroying that bacterial cell wall, that's actually kind of describing the mechanism of action of imipenem itself and any other actually of those extended spectrum beta-lactam drugs. It's unlikely that we'd need to use another drug with the exact same mechanism to help boost the efficacy of it. Usually we, if we're doing different kind of multimodal treatment with different antibiotics, they're going to have different mechanisms of action. And so that's why we can take this one out. So again, guys, here the key honestly is knowing that little bit of discrete knowledge, and you can remember that kind of mnemonic slant rhyme, the kill is elastin with cilistatin. To remember that, again, imipenem is inactivated in the renal tubules, and so what we do is inhibit dehydropeptidase 1 with cilistatin to kind of keep those levels higher and allow it to have greater efficacy.
Excellent, thank you, Ari. So, with that being said, I want to talk to you briefly about RX Coach. So what we do at RX Coach is, I always hear students say, oh, my friend said I should do this for the staff. I heard this or I read this online. And that may very well be true, but your friend isn't you. And everybody thinks differently. Everybody has different strengths and weaknesses. And so what we'd like to do is figure out what those strengths and weaknesses are through an assessment. We analyze that, and then based on your individual needs, individual strengths and weaknesses and learning style, we put together a personalized study plan for you and only you. And then we work with you to work on knowledge and content, but also work on test-taking skills and question dissection skills like we are today to help you maximize your potential on testing. And by working with you as an individual, we're really able to not only make your studying more efficient, but also help you get that score that you want. We've had a lot of students come to us, and we've had a lot of success with this program because of our individual and tailored approach. And if you guys think about athletes like LeBron James or Serena Williams, these guys are star athletes that are really good at what they do, but they still have personal coaches and personal trainers to help them maximize their potential on game day. And that's what we're here for as well. So if you're interested in RX Coach, if you like what you're seeing today, please schedule a free consultation with us to discuss the program and how it can benefit you like it has with so many other students at www.rx-coach.com. Excellent. I do want to ask you guys a question before we continue, and that is, do you guys currently have a USMLE-Rx subscriptions? I'll give you guys a second to take a look at that question and answer that. Curious to see, do you guys have a USMLE-Rx subscription? Please let us know. Give you guys a few more seconds to respond. For those of you who have not yet looked at USMLE-Rx, there is a free trial available, and I encourage you all to take a look at these resources like RX 360 Plus, which includes bricks, which I'll demo later, our question bank, express videos, and flashbacks. All of you probably have a copy of First Aid. Well, if you're enjoying that book and finding it helpful, you should certainly check out USMLE-Rx, because USMLE-Rx was created by the authors of First Aid. So it's a really nice complement, and it's called RX 360 because it really is holistic. It has everything you need to study and to stay organized. So it looks like about 55% of you have it. 36% of you don't, and 9% of you guys are in a trial or using a previous trial account. So for those 36% of you guys who haven't taken a look at the trial account, it's free. Take a look, and there's some free content there that you can learn from. And you know, a lot of our tutors like Ari and Lisa and Boris, all these folks have used these products to their benefit. So it's easier to start doing the right thing now while you're in school and studying for the exam, as opposed to having to scramble closer to test day. So with that being said, let's move on now to our third question of the evening. Remember that there is a raffle at the end, and attendance is a little bit lower than it normally is, so your chances are about double of winning this raffle. So make sure you stick around until the very end when Jeff calls those names out. You must be present to win. Friendly reminder, next week, 6 p.m. Eastern time, we'll be doing renal physiology with one of our other coaches, Kasha Bornstein. Excellent. So here we go again with our third question. As you guys can see, I have gone ahead and covered up those answer choices for you. And now we will read the lead in together. Which of the following is the mechanism of action of the medication the mother most likely used? Which of the following is the mechanism of action of the medication the mother most likely used? And we'll give you guys a couple of seconds to respond in the question box and let us know how many steps you think this question will require. Excellent. Looks like we've got some responses coming in here. Some people saying it's a 3-step or a 2-step question. And Ari will walk us through that here in a little bit. So let's go ahead and read that stem together. A 4-year-old boy cuts his finger on a rock while playing outside. After cleaning the wound, his mother applies an ointment containing a bactericidal agent that is rarely used systemically because of its nephrotoxicity. Which of the following is the mechanism of action of the medication the mother most likely used? Ari.
All right, thanks, Sean. So again, for this one, we'll kind of think about first how many steps we need to approach with this. And I think that this is certainly going to be at least a 2-step question, where we're going to need to go ahead and figure out what the medication is, and then yet again, a mechanism of action of that particular medication. So just like always, guys, we'll start at the bottom with answer choice E, and I'll read them aloud. So E inhibits peptidoglycan synthesis. D inhibits nucleotide synthesis. C inhibits DNA topoisomerases. B damages DNA. And A blocks aminoacyl tRNA attachment. So just like last time, guys, we'll give you a couple seconds to gather your thoughts, think about this one. And if you don't know the answer, just again, take your best guess. This is how we learn.
Thank you, Ari. Yeah, we'll give you guys a couple more seconds to respond. You know, this is a shorter question. As you guys know, a lot of these USMLE questions and NBME style questions are becoming shorter, but they can still be challenging, even though they're shorter in length. So we want to make sure you guys have all the tools you need to succeed, not only in medical school and on your exams, but also as you become a physician. So give you guys a couple more seconds to respond. All right, and let's see how you guys did. Looks like 39% of you guys picked answer choice A, which is blocks aminoacyl tRNA attachment. And in second place with 21% of you guys picking it was answer choice E, inhibits peptidoglycan synthesis. So let's see what the correct answer is. And the correct answer is E, inhibits peptidoglycan synthesis, and 21% of you guys got it right. So just because you see a short question doesn't mean it's easy. Just because you see a long question doesn't mean it's hard. This was a challenging question, even though it was short. And 21% of you guys got it right. Great job to you guys who did. If you didn't, don't worry. Ari is going to explain it to you now so you guys can get it right on test day. Ari.
Yeah, absolutely. So this one's a bit tricky, I think, for sure. And so for this question, we learned that there's a 4-year-old boy gets a cut on his finger, that his mom is going to apply an ointment, a bactericidal topical ointment. So bactericidal meaning it doesn't just kind of slow down the bacteria, but it actually kills it. And it's topical. We learned that we don't use it systemically because of its nephrotoxicity. Right? So we have to think about something that may not have a systemic form, or that we don't use in an oral or IV form, in other words, because it's too toxic to the kidneys. So I think of there are really two antibiotics, two types of antibiotics that might fit the bill here, and those are bacitracin and then the polymyxins B and E. So Sean has put this on this very nice diagram. This was when I was studying for step 1, an incredibly high yield page of first aid. So this shows you kind of all together where the different mechanisms of action might be for these things. So again, we talked about bacitracin, and what bacitracin does is it directly inhibits peptidoglycan synthesis. Specifically, it's by inhibiting the translocation of that D-alanine peptide to going outside from the inside of the bacterial cell into the outside to its cell wall. And then we can also see that we have these polymyxins as well. Now they're better against gram-negative bacteria, and what they do is disrupt membrane integrity. So again, in thinking about something that we only use topically, because it's so nephrotoxic, I would think, first of all, either bacitracin or polymyxins. And polymyxins, guys, if you haven't seen those before, sometimes one of them is called colistin. Those are usually present in things like triple antibiotic ointment. So if we go back to the answer choices now, and we see that, the first thing is, again, there's no answer choice that reflects what polymyxins would be. There's no answer choice that is anything like disrupting the cell wall. And so we are left with the correct answer then being E, inhibits peptidoglycan synthesis. So again, with this one, what we needed to figure out was what the medication was, what this topical antibiotic would be that we don't use systemically because it's too toxic to the kidneys, and that's bacitracin in this case. So bacitracin, and then we needed to think a step back and talk about, figure out what the actual mechanism of action of bacitracin is, and that is to inhibit peptidoglycan synthesis. All right. So we'll come back and kind of just talk about why the other answer choices here are incorrect. So starting with D, inhibits nucleotide synthesis. So nucleotide synthesis is going to be indirectly inhibited by any of our folate inhibitors. So things, if you remember, kind of like the TMP-SMX, right, trimethylprim sulfamide. And then again, it can cause nephrotoxicity like TMP-SMX, but we definitely use it systemically. So do you guys remember there's actually a particular opportunistic infection in HIV patients that we use TMP-SMX, that's a folate inhibitor, to either prevent, we use it prophylactically, and we also use it for treatment. Remember what that infection is? Yeah, so I'm seeing a couple things coming in. Perfect. Yeah. Absolutely. So actually, yeah, we can actually use it to treat toxo as well. So I was thinking pneumocystis jirovecii pneumonia, exactly. So, we certainly, what the point of that being, guys, is that yes, while that can cause kidney damage, we definitely do use that systemically. So that's why D is out. When we come to answer choice C, so we've actually seen this before on a previous slide as a previous answer choice, but with a different name. So DNA topoisomerases and DNA gyrase are kind of one and the same. So in this one, we're going to be thinking about fluoroquinolones. Again, things like levofloxacin, moxifloxacin, ciprofloxacin, and you can, Sean, if you want, flip back to that slide and we can see kind of where its, again, mechanism of action is up here, inhibiting DNA gyrase, right? So again, we definitely use these things systemically. We use them to treat things like complicated UTIs. In the case of ciprofloxacin, certainly levofloxacin, we can treat pneumonia with. And again, they're also not necessarily really associated with nephrotoxicity. So two reasons really why the fluoroquinolones inhibiting DNA gyrase, DNA topoisomerase, same difference here. Two reasons why answer choice C is out. All right. So if we come to answer choice B, damages DNA, this is kind of a new mechanism of action in terms of the answer choices we've gone through. So I think this is describing metronidazole. Metronidazole, and that is an antibiotic that causes free radical damage to DNA. So you can see up there DNA integrity up at the top via free radicals. It kind of intercalates and gets itself into DNA and disrupts it that way. Now metronidazole, if you remember, we use it to treat a particular type of bacterial infection. And so do you remember what type of bacteria would we be targeting with metronidazole? And this is a broad class, not just like one particular bug. Yeah, so there's a few direct and specific examples, for instance, like bacterial vaginosis for sure. But we call metronidazole the bug we use to treat, absolutely. So some other things coming in, Gardnerella, C. diff, we call metronidazole the antibiotic that we use to treat anaerobic bugs below the diaphragm. So you want to think metronidazole, anaerobes, things like C. diff would be certainly a great example. And again, we certainly use this in oral form. So two reasons why this one would be wrong. Number one, metronidazole we do use systemically. And also, again, it's not really commonly associated with nephrotoxicity. We're going to think more about things like a disulfiram-like reaction, where you get really sick whenever you drink alcohol as you're taking this medication, maybe headache, sometimes kind of GI upset, but not generally kidney damage. All right, and then finally we have answer choice A, blocks amino acyl tRNA attachment, and so this one was certainly a tricky distractor. Now this is describing one of our classes of 30S inhibitors. So one of the classes of antibiotics that blocks the small subunit. Specifically, these are the tetracyclines that end up blocking the tRNA binding. So tetracyclines, you can think it starts with a T, tRNA. So they block that elongation step of protein synthesis. Again, these guys like doxycycline for sure are used systemically to treat things like atypical pneumonia or spirochete infections. And also these are also not normally known to be associated with nephrotoxicity. So we really had to kind of come up with, again, two parts to this. We had to figure out that this was bacitracin, and the reason why is because number one, it's not used systemically because it's so nephrotoxic.
Excellent, thank you, Ari. Wonderful explanation. And you know that this image from first aid is really a great one to help you organize your thoughts. So make sure you take a look at it. I think it'll be very helpful for you. Like Ari mentioned, it was helpful for him. That's a nice way to keep everything organized in one nice, concise diagram. Excellent. So now we will move on to the last question of the evening, but make sure you stick around until the very end. We're going to do a very special raffle. Remember, next week we'll be doing renal physiology. So we hope to see you then. All right. If you're interested in RX Coach, if you like the way we're dissecting questions, pointing out these clues and explaining the correct and incorrect answer choices, going over that content review while also highlighting the clues in the question. If you think you could benefit from a coach doing one-on-one sessions, please visit rx-coach.com to set up a free consultation to discuss the program and how it can benefit you like it has so many other students. And here we go with our last question of the evening. As you guys can tell, I have went ahead and covered up the answer choices for you. And now we will read the lead-in together. Which of the following describes the mechanism of action of the drug most likely prescribed for his community-acquired pneumonia? I'll give you guys a couple of seconds to respond in the question box and let us know how many steps you think this question will take. And then we will read the question stem together. Excellent, we see some responses coming in, and Ari will go over those steps with you here in a moment. Let's go ahead and read this question stem. A 51-year-old man comes to the physician because of diffuse muscle aches for 3 days. He was started on simvastatin approximately 4 months ago after laboratory studies showed an LDL level of 244. 1 week ago, he was treated at an urgent care facility where he was prescribed an antibiotic for empiric treatment of community-acquired pneumonia. On physical examination, there is no warmth, swelling, or discoloration of the affected areas. Which of the following describes the mechanism of action of the drug most likely prescribed for his community-acquired pneumonia? Ari.
All right, thanks, Sean. So again, the first thing that we want to think about is how many steps is it going to take us to figure out the correct answer to this question? And based on the lead-in here, we actually are already given what his diagnosis is, right? We know that he had community-acquired pneumonia. And so I think this is going to end up being a two-step question. We know what the diagnosis was. We first need to figure out then what drug did we prescribe to treat it, and then think back from that for step two, what's the mechanism of action of that drug? So here, which of the following describes the mechanism of action of the drug that was prescribed for his community-acquired pneumonia? E, the formation of toxic free radical metabolites. D, binding to penicillin binding proteins. C, binding to the 50S subunit of the ribosome. B, binding to the 30S ribosome subunit to inhibit initiation of protein synthesis. Or A, binding the 30S ribosome and blocking amino-acyl tRNA attachment. So just like always, guys, we'll give you a little bit to think over that. And when you're ready, select one of these answer choices in the poll.
Thank you, Ari. Once again, our last question of the evening. Hope you guys are finding this question lab to be helpful. We love having you guys here. We love hosting this. You know, we're all going through a lot of stress right now, and hopefully this is a nice thing to look forward to every single week and get a nice review under your belt as you're studying and preparing for these exams. So we'll give you guys a couple more seconds to respond, and then it will be time for Mr. Jeff Downing to talk about our very special offer that we have this evening, as well as give away two prizes to two lucky winners. So make sure you stick around. Excellent. Looks like we have a lot of answer choices in. Let's give you guys a couple more seconds to respond, and then we'll go over your responses and the correct and incorrect answers. All right. Looks like in first place was answer choice C, with 43% of you guys picking binding to the 50S subunit of ribosome. And in second place was answer choice B, bind to 30S ribosome subunit to inhibit protein synthesis. Let's see what the correct answer is. The correct answer is C, binding to the 50S subunit of the ribosome, and 43% of you guys got that right. So great job to those of you who got it right. If you didn't, that's okay. We're all here to learn together, so you guys can get it right on test day. So with that, I will hand it off to Ari.
Absolutely, and these mechanism of action questions can be particularly tricky. So let's talk about the hints to this one. So we're given here that we've got a 51-year-old man. He has a 3-day history of muscle aches, so pretty acute presentation of muscle aches, myalgias. And then we've got a few details of his medical history. Number one, that he's been on a statin for the last about 4 months for hypercholesterolemia. So he's been on simvastatin. And then number two, that just recently, a week ago, he started a new antibiotic for community-acquired pneumonia. And then finally, we're also given actually some pertinent negatives. We're told that there's no warmth or swelling in the affected areas. And so again, that's kind of pointing us away from this being something like an infection of the skin, a cellulitis, or infection of the muscle that's causing the pain. There's not an inflammatory response going on. And so this one is actually kind of tricky because we need to think a little bit about the pharmacology beyond antibiotics and think about simvastatin. And so if you guys remember, I know this is a little bit bonus points because we're doing micropharm here, but what exactly do statins do? In other words, how does statins, what's the mechanism of action?
Inhibits HMG-CoA reductase. We got a winner.
Excellent. Absolutely. So statins are very commonly prescribed drugs. for better or for worse, and they directly inhibit HMG-CoA reductase, absolutely. And another thing you need to know, besides that mechanism of action of statins, is how they're broken down. So statins kind of get processed and broken down by the cytochrome P450 system in the liver. If you guys recall, one of the big side effects of statins that we look out for is myopathy. So muscle aches or muscle pathology. And that could be, again, all the way from just simple muscle aches to actually straight up even rhabdomyolysis. One of the ways that we can provoke this side effect is based on the fact that statins are broken down by that P450 system is by co-prescribing a drug that would block that pathway. So co-prescribing that along with the statin. And so that's really the underlying thought process here. There's a lot of different pieces to put together. Okay, so in this case then, we're looking for an antibiotic with two features. Number one, it needs to be one that blocks that cytochrome P450 system, which again, that's going to increase the toxicity of the simvastatin he's been on. And number two, we actually need to pick one that we also use to empirically treat community-acquired pneumonia. And so what that brings us to is our macrolide class of antibiotics. And so if we can flip to that page where we talk about macrolides, one thing you guys might want to know is this is actually either going to refer to erythromycin or clarithromycin. So you can see in adverse effects, there's this nice mnemonic macro. And then in addition to that, you might want to remember that it inhibits cytochrome P450, two of these. So azithromycin won't, but he must have been put either on clarithromycin or erythromycin. Right, so macrolides, looking at the mechanism of action, they are 50S inhibitors. So they bind to the 50S or the large subunit of bacterial ribosomes, and they're bacteriostatic. They slow bacteria down to block translocation. So all of this points to answer choice C. Macrolides are one of our first medications that we would use to treat community-acquired pneumonia, and they're really the only one we're thinking of that causes CYP450 inhibition. So now let's go through the incorrect responses. Answer choice E, we saw that one actually in the last question. This one describes metronidazole, formation of toxic free radical metabolites. And so remember for that, the side effects are more like a disulfiram-like reaction with alcohol, sometimes a headache, a weird metallic taste. I don't think I mentioned that, but that can be a kind of unique side effect of metronidazole. It's not a CYP450 inhibitor, and it's also definitely not a first-line agent for CAP. So again, we use that for anaerobic infections below the diaphragm, and then certain protozoal infections, as you guys noticed, like trichomonas or giardia. D is binding to penicillin binding proteins. So that is going to describe any antibiotics within the penicillin class. There's a bunch of those. And penicillins, they are effective certainly against strep pneumoniae. That's our most common cause of community-acquired pneumonia, but we're usually not going to start them empirically. There's a whole lot of other bugs that have resistance against them. In addition, penicillins are not going to cause CYP450 inhibition, so that's out. We go up to answer choice B. So binds to the 30S ribosome to inhibit initiation. What that's doing is describing the mechanism of action of aminoglycosides. So those are things like gentamicin or streptomycin, amikacin. Again, these guys don't cause CYP450 inhibition, and they're also not used as the first line treatment for respiratory infections. And then finally, A, binds to the 30S ribosome to block that aminoacyl tRNA attachment. We've seen that one before. So this one is describing the tetracyclines. Now, there are certain tetracyclines like doxycycline. We can certainly use it to empirically treat community-acquired pneumonia. So this is a good distractor. It's a drug that he might have been prescribed for this, but we should recognize again that the myopathy wouldn't make sense in this context, right? Tetracyclines they don't cause CYP450 inhibition, and then by themselves as well, myopathy is not a side effect here. So we think about with these drugs, side effects more like GI upset or photosensitivity. And if you remember too, this is a pretty common test question. Tetracyclines are also really teratogenic, so we try to avoid them, in fact, all the way up until kids are about 9. Do you remember why that is? There's a particular mnemonic, but why don't we use things like doxycycline in either pregnant folks or in little kids? Yeah. So I see this issue of gray teeth, stained teeth, bone issues. Absolutely. So either or. The mnemonic is teeth recyclin. So it can certainly cause discoloration of teeth, and it can also cause bone malformations or inhibition of bone growth, especially in the fetus. So very nice job, guys. Again, this was a pretty intense set of questions, but also very high yield for your exam to know these specific mechanisms of action.
Excellent. Thank you, Ari, and wonderful job tonight. Really loved your explanations, and thank you for being here. You know, one of the things that students always ask us or tell us is that we have so many resources. We don't know where to start. We don't know how to stay organized. We don't know what to do. And having all those resources, sometimes it may help you feel good that you have it all, but then it can really end up being counterproductive because it takes you so long to get through everything. So that's why I really, really like bricks. And I want to share a brick with you today related to the first question we did about TB. As you can see here, we have the learning objectives on drugs, how to treat TB. These are what you should be able to know and explain once you finish this brick. Then we get into the review of the content. We have some mnemonics here for you guys. As you keep going, we've got some flashcards as well, some quick questions, explanations as well. We'll continue. And as you guys start to review this content and get towards the end, you'll even see some clinical correlations. But then once you get to the end of the brick, you will see that there is a nice little summary that summarizes all of the key points that you should take away from this brick. We even have some practice questions, and you must select the correct answer to get an explanation. That's a great way to keep you on your toes. Then here are the learning objectives that you should be comfortable with, and you can mark those off based on your confidence. But here's one of the greatest parts about the bricks that really helps you stay organized, right? When you're looking at a subject, if you want to learn more about it, you want to watch a video about it, great. You can go to our Express video. You want to quiz yourself with flashbacks, you can go into flashbacks. You want to do some practice questions, you can go right into COMLEX. You want to read a little bit more and see where it is in first aid. I saw a lot of you guys asking us, hey, where is this in first aid? Where is that in first aid? Well, with bricks, we tell you, so you know exactly where it is. So if you guys haven't taken a look at RX 360 Plus, you haven't looked at our new bricks offering, take a look. There's a free trial available online with some free bricks and some questions. Take a look. If you like the questions we did today, they all came from COMLEX, right? So take a look at this resource. It's a wonderful one. It's been around for a long time, has a great reputation for a reason and a proven track record for success. So make sure you take a look.